you ever restage patient based upon his or her progress? Yeah, absolutely. Tracy, do you want to take that one?
Yeah, actually, a couple of cases over the past few years where we've had stage 4 lung cancer patients. We had a young fireman who had a remarkable response in his lungs and had this very isolated residual disease, and then actually had a lesion in his liver, and it was isolated as well. And so healthy guy, believe it or not, with cancer, and because of the remarkable response from the chemotherapy, we were able to actually resect both the lung and the liver. We also have had other people with what we call oligometastasis. Oligo means one, and so, for instance, patient comes in, you think she had a seizure, you find out there's a brain tumor, but it's an isolated brain tumor. It gets resected, so they have a craniotomy, and we find out that their lung, because whenever they come in with a lesion in the brain, you always go looking everywhere in the body for where this thing came from, and you find an isolated lung lesion that you have proven to be lymph node negative, and you're able to resect that as well. I have a patient now with that I have several patients with that exact scenario who are in their, 4th and 5th years of cancer, cancer-free survival, as we call it. And you have to really think about cancer as a chronic disease, and all cancers, even the ones that can be, quote, cured, because what people don't realize is that 50% of cancer patients can get a second cancer in their lifetime. It's all about those oncogenes that I talked about and the suppressor genes. So, once you get one cancer, you are more vulnerable to getting a second, and that includes lung. We have some patients that may have had a stage 1 disease, had resection, and then come back with another stage 1 or even a stage 4 later on, maybe 5 and 6 years out. So you really, the key is to do the research, to be as aggressive a treatment as the patient can allow us to be, meaning that performance status we talked about, and to just keep looking for survival, or for treatments to increase survival. So actually, the word cure is kind of going out of fashion with cancer treatment, because we have found that it is really a chronic disease, and that's just a better way to think about it. A chronic disease that has flares, and we'll put you in a period of remission where the cancer's not growing, and then, if you come out of remission, we'll give you the treatment again, hoping to kind of stunt its growth and put you in remission again, and it's just kind of a lifelong journey, even if you have surgery or not. So